What is rabies? Rabies is a deadly viral disease caused by the rabies virus. It affects the central nervous system of mammals, including humans, and is transmitted primarily through the bite or scratch of an infected animal. The virus spreads through saliva, entering the body via broken skin or mucous membranes. How do dogs get rabies? Dogs usually get rabies when they are bitten by another rabid animal, such as a stray dog, bat, fox, mongoose, or raccoon. The virus is transmitted via the saliva of an infected animal and travels through the nerves to reach the brain, where it multiplies and causes fatal inflammation. Are dogs the only animals that get rabies? No, rabies affects all warm-blooded mammals. In addition to dogs, rabies can infect cats, monkeys, cows, bats, foxes, wolves, and even humans. In India, stray dogs are the most common carriers, but globally, bats and wild animals also contribute significantly to rabies transmission. How rabies affects dogs. In dogs, rabies causes severe brain inflammation and leads to neurological deterioration. There are typically two forms: furious rabies, aggressive behavior, biting, and hyperactivity. Paralytic rabies, weakness, loss of coordination, and paralysis. Once symptoms appear, the dog will die within a few days. There is no cure at this stage. Symptoms of rabies in humans. In humans, early symptoms include fever, headache, and weakness, followed by anxiety, hallucinations, muscle spasms, hydrophobia, and eventually coma and death. Once symptoms appear, survival is extremely rare, and death usually occurs within 7 to 10 days. How to prevent rabies. Rabies is entirely preventable with timely action. The first step after an animal bite is to immediately wash the wound with soap and running water for at least 15 minutes. Then, a post-exposure prophylaxis, PEP, treatment should be started, which includes a series of anti-rabies vaccines, and in serious cases, rabies immunoglobulin, RIG, for passive immunity. When rabies becomes untreatable. If symptoms have already started, rabies is almost always fatal. There is no cure once clinical signs appear, which is why early intervention is critical. This makes prevention and immediate response after exposure the only way to save a life. Prevention in dogs and communities. And to prevent rabies outbreaks, it's essential to vaccinate all domestic dogs and cats regularly. Avoid contact with stray or wild animals. Educate the public about early symptoms and actions. Report any aggressive or suspicious animal behavior to authorities.